Right. Harsha, can you hear me? Am I audible?
Yes, sir. Please go ahead, sir.
Okay, my presentation is on. Should I think, should I enable the video? I think this should be okay. Or should I enable the video?
Up to you, sir. Up to you.
Okay, 1 second. Fine. Okay, I'll just leave it to this. Okay. A very good evening to one and all. I'm Dr. Rajendran Dinesh Kumar, and on request, today I'm going to talk about tips and tricks for presentation skills. I'm an assistant professor in the Department of ENT and Head and Neck at Rajajeshwari Medical College and Hospital, Bangalore, and a consultant at Trustwell Hospital, Bangalore. So, if at all there is any queries, we can stop me in the middle and we can have an interactive session. But today's topic is on tips and tricks in presentation skills. So let's go on the basis of timeline. So once you have a notification for a conference, it is usually sent out as an announcement in the form of letters, WhatsApp, or through previous conferences where they make an announcement. Usually they have a poster presentation for postgraduates, consultants in the form of posters, case reports, and case series. There is a request for an abstract which has a deadline to submit, and then I will share a copy of the abstract, how to write an abstract, and the deadlines have to be met, and most of the time as the deadline nears, we may have a request to extend the deadlines. So that's a part and parcel of any conference. So the instructions here will be made very clear, whether it is competitive or a non-competitive sessions. And as a postgraduate, you should have a certain bona fide certificate to be eligible for a particular session in a postgraduate competitive session, and your registration numbers for the conference. So what are the assessment modalities which we have to consider when we have to go for a conference where we have to present our scientific material? The assessment will be based on the quality of the content and the scientific content, whether it is relevant to the current presentation or whether there is any add-on to already existing knowledge in the form of recent advances. Usually there is a timings for every presentation. If it is a case report, it will be 4 minutes plus 2, where the speaker will speak for 4 minutes and there will be a question and answer for 2 minutes. If it's a case series, it will be for at least uh, 8 minutes plus 2 minutes question and answer. Here, certain presentation skills, certain criteria will be assessed, and more importantly, the body language of the candidate presenting the presentation. This will be usually followed by a Q&A by the assessors or the judges for the session. So an abstract is a simple enclosure of a document, whichever session you are presenting. It could be a case report session, it could be a case series session for a postgraduate, or it could be an e-poster session, or it could be a video session. So the usual outcomes are either accepted or rejected. Uh, so depends, if a lot of students submit the similar topics, usually some of the abstracts can get rejected. But nowadays, considering that fact that many postgraduate residents are applying for qualifying for exams, where they should have the latest criteria which meets that one paper or one poster or one scientific publication where you are the first author for the PG presentation. The rules now have changed, so this is how it is, along with other criterias, BCBR, ethical committee, and ALS and BLS course certification. Now, when any student goes to a conference to present their particular scientific material, they should know the level of evidence for their scientific session. If you are presenting a meta-analysis or a systemic review of your study, it usually carries a much better weightage and much better information, and a very good chance to share your content with the audience and the judges. Usually that is appreciated much better. But if we have a case series or a case report, As you see in the timeline, it stands at a very low level of evidence. Animal studies are even lower, case controls a little better, and cohort studies, prospective, also a little better, but the more ones are randomized control trials. But these become very difficult for students to present over time because they have only 2 years or 3 years of their PG days. So usually more or less students end up presenting cohort studies, which is an observational studies, which has a better appreciation. As we go down the ladder, case series and case reports, usually they have very less level of evidence. So this is something which we should know. Recently, this particular content, I would like to thank AOICon Karnataka for giving me an opportunity to judge their session. And this was one of the criteria where I judged an e-poster and also a paper presentation session. So if you look at it, the judging criteria for e-poster and the guidelines for presentation were based on originality, significance, presentation, and certain methods. To go more in details, originality, whether this content has been presented before, is it a new content or it is a new approach for an old problem? So because we see most of the time students coming to the conference presenting a paper or poster which is usually a new topic for them, but it would have been presented earlier by some of their seniors. So we should try to avoid this, and actually in case we have any new content, we should add any scientific relevance. Why have I presented this topic? So if that is there, it will add to some originality. Otherwise, there will be some kind of a bias and copyright issues. Significance. How your content yielded any important conclusions or it helped in diagnosis or treatment for a certain disease. This is something which we'll usually overlook, and if at all we can present it in such a way, it can add to certain importance. So if PGs don't overlook this problem, usually they end up answering questions which is very well known, and if they have a presentation of an unusual case and they answer certain questions about it, they usually get a good mark in this regards. And regarding the presentation, how logical was the presentation? Was the presentation interesting? And how clearly it is written and it is free from any significant grammatical problems. These are certain things which are also taken into consideration. And certain methods, if applicable, how suitable is the research designed for the stated objectives, and how appropriate are the statistical techniques which are applied for the case. Another thing which also added to the assessment was the visual impact. How effective was this poster visually? How valuable is each and every figure and graph in the viewer's point of view with regards to understanding this research subject? And when there is an interview being conducted between the presenter and the judges, how knowledgeable is the candidate and how was their conversation and with regards to their presentation? And did it yield any good result at the end of their conversation is something which we will take into consideration. Regarding the rarity, usually if it is a very common posture, they usually may tend to ignore it. But if it is something uncommon, that will be most commonly it will attract some eyes and visualization to it. So the rarity of research work or case report presented can give better acceptance. And another large point is innovativeness. Anything innovative method in the research presented in the posture, like a treatment or a diagnostic criteria, if at all it was followed. Another thing which I observed recently is students presenting e-posters with animations. Like in Harry Potter, they have automatically videos running or some scenes of enacting certain steps or certain things like a foreign body removed from certain critical areas, and how complications were addressed. That also add to some amount of innovativeness. Regarding the scoring rubric, they had given us a scoring system where each and every criteria were assessed, and they were given scores of 5 as the maximum and 1 as the minimum, or even 0 in fact, because 0 had no assessment. but 5 was extremely complete and accurate in every way. 4 was the content had very minor omission in detail, but not in the entirety. And 3 was there was small weakness noted in the content or format. 2 points were an important weakness was found in the content, which cannot be ignored, and 1 point was given to a major weakness found in the content or format. So 5 to 1. So here in that particular conference in AOICon with a special mention, all these contents were taken from them, and I would thank Dr. Dhanpal sir and team, and Dr. Sunil Dutt and team for giving access to this content. Uh, so e-poster guidelines for them was in a A4 size paper and was projected on an e-poster uh, monitor. So, and they were requesting that this file should be easily readable and should have your serial number, your name, and your institution, which will be put along with your photograph. So they were requesting to convert the PPT of the file or the PDF of the file to a JPG format, because sometimes there can be issues regarding compatibility. You would have created your fonts, you would have created your animations in a particular Windows or iPhone content, uh, right? Harsha, the share has stopped. 1 second. 1 second. Yeah, I got it. Yeah. Okay, we are back now. Fine. So they would request you to convert it to a JPG format, which will fix your particular presentation in whatever font it is, so that there will not be change in the characters or particular font size or text size and all.
Slides are not seen, sir, now.
Now is it seen? Is my screen visible?
No, sir, I think it's not visible, sir. Can you stop the sharing and try
Yeah,
again, sir?
I'll do that. I'll do
Someone
that.
has just shared their screen, that's why it has gone, sir.
Okay, okay,
So,
fine, fine. Please enable this one. You cannot share screen until the host. Can the host enable me to share? Harsha, can you enable? Just try to.
Just change the settings. Now only you can present.
Okay. But for some reason, I'm not able to. Cannot share content. It is mentioning as that. Okay. Fine. All right. I think we can see the screen right now. Correct?
Yes, yes.
Okay, fine. So we were talking about you have created a file in PPT or a PDF format, but they request you to send it in JPG format, and they have mentioned here where you can go and do it for free. And these were certain the instructions, and then you are supposed to send your poster by certain mail account for communication. So usual presentation sessions are either competitive or medal sessions. And as I mentioned, case series, usually you'll have a time of 8 to 12, 8 to 2 minutes. 8 minutes stands for your presentation, 2 minutes for your question and answer session. Case report, usually you will have 4 minutes plus 2 minutes question answer session. So the recommended amount of slides to cover that 8 minutes would be ideally 20 to 25 slides. The less is even better. And for 4 minutes, either maximum 10 slides, the less is even better. For free paper sessions, they are usually non-competitive sessions where people come and share their scientific content for the benefit of the audience. So with regards to case report, what exactly do we need to mention in our slides? Because there is always a query, sir, we have submitted the abstract. What do we do next? How do we go about preparing my presentation? So if you note, the first particular slide will be a background or introduction. What is your topic about? Then the second slide would be something about your case, where you mention something about the details of the patient. A 45-year-old male presented to the OPD with so complaints, and you give in important signs and symptoms. Next, clinical presentation and what investigation was done. And usually the audio video content will be the investigations whichever were done, the CT scan, ultrasound, chest X-ray, relevant content will be shared, or it could also include certain video content of the management, management whichever was done. Following which, what are the post-operative instructions, and there will be conclusions, and there will be discussions, and in that format, and then there will be a reference take-home message. The reference citation should be in preferably in Vancouver's method, and as you have very limitation number of slides, it is better to avoid using one slide which mentioned thank you. Rather, you can mention the take-home message as your last slide. The reference citation in Vancouver's method of citation includes this particular format. Just for the benefit of postgraduates, I will just give one example. This is one of my thesis article which is published in the year 2016. Here you can see that the author's name is Dr. Rajendran, Dr. Dinesh Kumar R, and et al. Et al. Means whoever are a part of this group. If I had 2 or 3 members in the part of this group, I need not mention all their names. I can mention the first author's name and et al. Dot. Okay, and this is the title of the study: comparative study of improvement of nasal symptoms following septoplasty with partial inferior turbinectomy versus septoplasty alone in adults by no scale, a prospective study. So if you notice that this is a prospective study, the level of evidence is much better, and this was published in the Indian Journal of Otolaryngology and Head and Neck Surgery, and it was published in the year 2016 and in the September version of the journal, and this is the 68th volume and third uh, part, and this page number is 275-284. So this is a Vancouver method of citation. Usually all this need not be done, because nowadays we have, if we type in any article, there is a link which mentions as cite now. You can copy paste the entire link, and that will help you to save all the time and hassles. Okay, so but mentioning the citation in Vancouver's method is of importance, because the judges will know whether you have come prepared and you are aware of certain finer details in your presentation. When it comes to case series, it is about a research topic which is more structured. It will usually start with a background, aims and objectives, and usually your content should be in the form of bullet points. We don't want paragraphs. Before attending this session, I saw one particular example where a lot of paragraphs were mentioned. Paragraphs are a little bit of a turn off, because nobody will have time to read your material. By the time you go to the next presentation, next slide, they would have missed out on certain things and they would not follow your presentation. So keep it crisp. What is your aims? I want to establish so and so. And objectives, I want to determine whether the study has any significance. What is the material methods? Study is done on 50 subjects, male so many, female so many. And results, you will tell whether your study showed any significant improvement of following the study, or whether it gave any conclusive evidence. And discussion, where there is a particular discussion or length regarding your study versus other studies which followed the same principles. Here you can use images, graphs, which will help in giving a good presentation, and you can share your audio video content, whatever was the relevant for your particular topic, and how was the condition managed, what is the take home message, same reference citation, and as possible avoid using thank you as a slide and add take home message as your last slide. So what is the process? As in, I would like to say that presenting is a skill, and like in chess, there is an opening game, there is a mid game and conclusion game. So your presentation also should be in this format. It should be in a pretty much organized format, and you should not be haphazard in your presentation. So your outline, when you have a presentation, let's take my presentation for an example. Outline, there is a very big background as a heading, then you have bullet points, and here preferably I would like to have blue color background with yellow color, or white color text, or black background with white text. If you avoid colors, fancy colors like red and green together, because these are colors which will not be pleasant to the eyes when looked upon from the audience perspective. It may look very shiny and colorful, but when you're sitting in the audience and when you're trying to focus your vision on the presentation, there will be some amount of headache experienced by the end of your presentation. And usually a 4:3 or a 16:9 kind of an orientation is good for a template, and fonts has to be used accordingly. Avoid using fancy fonts which are not readable. Try to use legible fonts which are readable and presentable, like the Romans, Times New Roman, Calibra, and other things, Arial View, Arial text, which all are helpful. Have powerful headers. Avoid the boring headers like introduction, aims and material, but try to involve in certain ways that the people know that you're talking about the background of the particular thing, particular material of scientific content. The lesser amount of text is better. If you add more images and you talk to the audience, facing the audience and the judges, it will add more information, and it will show that you are confident of your presentation, you have come prepared for the presentation. Having powerful graphics and transition of your slide and sync with your presentation adds to much better delivery style. Having eye contact and a strong body language will definitely improve your presentation skills. So what goes about the slides is it has to be to the point. See, my first particular slide, if you notice, it is to the point. My audience have already known what exactly I want. Then there is a planning and the dimension, and stick to the theme and avoid deviating from the theme. Make sure your colors work in low contrast. They are simple to the point, and I follow the 7-7-7 rules. There should be 7 lines. There should be not more than 7 words in that particular line, and it should be having 7 bullet points. Okay, 7 lines, 1, 2, 3, 4, 5, 6, 7. Not more than that. If I have more slides, it's an overcrowded slide. So as my image tells, less is more, minimal text, and more is more content. Images should be to the point and very well describing. Avoid adding low quality image and low quality videos. They are a bit of a turn off for any audience. And follow a consistent pattern. Don't make it like red color first slide, red blue color. It will look like a circus. And graphs should be able to distinct. You should have an assessment that it should distinctly be differentiated and help in easy understanding even at a glance. Skip unnecessary content. Avoid adding contents which are not relevant. You would have done so many things, like I have done BTCT, I have done CBC for the case. You can mention routine investigations were within normal. If at all you're asked, you can mention routine pre-operative investigations were normal, within normal range. Only significant finding was with the CT scan. Avoid adding all unnecessary materials like HB was so and so, CBC was so and so, unless and until it is relevant for your case. References in the Vancouvers and take home messages are always an important assessment, so that it makes the life of your judges easy. They may ask you, what is your take home message? That time you should not give a staring look. That time you will be shown that you have not come prepared. So if you see, this is how you should be there in the presentation. Come formally dressed. Don't come dressed in a casuals and shabby looking. Better be presentable, and you're talking to audience who are listening to you. Doesn't mean that you come shabbily dressed and unpresentable. Okay. So blindly read the content. So if you are reading the content directly from the laptop and avoiding making eye contact, that's a bit of a turn off. And turn to the board occasionally, and if they give you a hands free, use the stage. Use the stage. The stage is yours. You are having that 4 + 2 minutes of your time on the stage, or your 8 + 2 minutes on the time of your stage. That time nobody will interrupt you. So use the laser pointer or a slight transition check wherever necessary. Don't overuse the laser pointer. Don't try to rock around the laser pointer on the screen, moving left and right all of a sudden. So you should keep your focus on a particular point and keep your laser point there, and then you guide your audience that you're going to this particular image so that they are in sync with your presentation. Be audible. Do not fill up pauses like e and all those things. These are a bit of a turnout showing turnout that they tell that it is not a well prepared presentation. The audience were not interested. The speaker himself was lost. The speaker didn't know the basic presentations, and his presentation got switched off, and later on he had to log in again and things like that. And better be prepared. Any technical glitches like audio video glitches, make sure you have a backup, because all these are timed sessions. You will not be awarded any other time extra, and whenever you present beyond time, you end up losing some marks and scores. So some common mistakes which students or any presenters make, not only students but any presenter, is coming unprepared. If you're nervous and you lack confidence, there will not be any clarity of the content, and your scientific presentation, whatever it is, will just be a mere reading of an article from a newspaper. So don't rush and read. Many students prepare presentation and they come to the conference. They are in a nervous state of mind. All you need to do is relax and prepare once, like how they do shadow practice in cricket or boxing. You first prepare once, see yourself in the mirror and talk, and how you can express yourself. If you rush read, just like how you read during your presentation in college, you will finish the presentation, of course, before time, but a lot of the people would not have understood what you were presenting. So the time management is important. Don't get panicked when it comes to time session. I see many students or presenters, suppose they are given 4 minutes plus 2, there is usually a bell which rings at third minute, reminding the speaker that you just have 1 more minute left. The moment that bell rings at the third minute, they usually start rushing the slides. It's like, you're galloping to make ends meet. So don't forget to make eye contact with the audience and the judges, because that is one thing which will give you some bit of confidence, and you'll also know how interested people are to listen to your content. So this particular slide, positive or is negative, it is actually the representation of your work. What you mention in your presentation is something which will leave either a positive or a negative impact in the audience. But you should also remember that all contents, whatever shared by our residents or by speakers, this is your own work. Either it is new or it is relevant to a recently known topic, or even an age-old topic. The important message every speaker should know, that why am I here and why have I come here to present. The judges will ask you, what is the novelty of your topic? What is new in your topic? Is there anything innovative aspect? Because we already know that CSOM treatment of choice was surgical, either there's graft uptake or graft failure. But what else is there? Have you done any particular research apart from this? That is what we will have to know and assess. And take home messages and the interactive Q&A session in which is left to the judges. Audience has a very limited role to ask questions to the speaker. It is depending on the rules set by the scientific committee, and if the judges are the solely the persons asking questions, they can do so. In case the judges leave it to the house to ask any questions, they can do so. And usually I would suggest, if at all there are any feedbacks, you can mention your email IDs in the end of your presentation. If there are any feedbacks or queries which any people didn't understand, you can send them a mail to your department, mail to your email ID. Avoid sharing mobile numbers, because usually it's a bit of privacy, and try to add email IDs so that people can remain in touch uh, for your conversations related to your scientific content. So why should we have all this presentation? Is it only because we have to be eligible for exams? No. We should also remember that learning is a continuous process, but at the same time, when we present, we develop confidence. We develop confidence how to speak, how to present amongst an audience. Some people have stage fear. Some people, they are not confident in their language. Some people, they develop kind of a jitter and shiver when they see the audience, or when they have a technical glitch, they panic. Remain calm. Don't worry. It's a learning experience. Most of the time, students come prepared and they're confident. Some are overconfident. Some are not at all confident. So my only suggestion is, whatever you're presenting, it is a learning feedback, a learning experience. You take away home the critical feedback given by the judges or the audience. These are certain methods which will help you to improve further. Whether you get a prize for your presentation or not, it will give you certain ideas on how to improve and give a better perspective so that you can come better prepared next time. Yes, awards are certainly an indicator that you have done really well and your presentation had a good scientific content, it had originality, it had innovations, and it also had certain take home key messages, and it also shared certain important practical values which they can employ in their daily routine practice. So this is also a method where you interact and meet like-minded colleagues in conferences. And even the judges also will recognize your work. And tomorrow they may happen to be your own teachers, or maybe they'll be taking interviews, and they will also recognize you that you had presented this way. So that will give a good perspective. So also, this is my last slide. It doesn't say thank you. It says let's discuss. So if at all there are any questions, we can have it now. Harsha?